It's your trainer Ali T here from Fit&Flexi. Today we are talking all about hormones and specifically how to train around your menstrual cycle. For the purpose of today's chat, we are going to think about our menstrual cycle as a 4-week cycle. Now obviously everybody's menstrual cycle is completely different and that's what makes us unique. But for the purpose of this chat, we are doing a 4-week cycle. So week 1, we are starting off with your period. Now at this time, your hormone levels are really low. Obviously you might know yourself that your energy levels will be low with it. You might get cramping and aching and feel like you kind of want to reduce the intensity of your exercise. And in this week, I recommend doing that. So maybe think about more walks or yoga to really help with any pains or aches or cramps that you have. Try not to stop exercising altogether, but just think about reducing the load and don't be upset if your normal strength training or fitness levels or exercise effort and energy feels lower than it normally does, because this is totally normal and it's expected on this week. Also, to go along with that, you might be feeling a lot of cravings, which is the usual kind of chocolatey cravings that we think about and associate with period time. So this is again really normal because our iron level is very low in our body. You can help to reduce those cravings by eating red meat or really green leafy vegetables such as spinach at this time, because both of those include a lot of iron, as well as chocolate, and that is why we normally crave chocolate at this time. So if you're trying to stick to a diet and this particular week of your period you just can't, be a little bit more chilled about it and relaxed on yourself, because it just might not be as possible to be as strict as the other 3 weeks in the month on your diet. Week 2 of your menstrual cycle is also week 2 of the follicular phase. So just after your period, as the hormones are starting to surge up to your most fertile part of your menstrual cycle at ovulation. This is a really, really good week for a little bit more energy in your body. So maybe it's a good week to start strength training, lifting a little bit heavier, and you will start to notice your muscle definition pop out a little bit more with that strength training. However, be careful when you are exercising, because there is a slight increased risk of injury as there is a reduced amount of tendon collagen synthesis after exercise. So because of that, warm up a little bit more before exercise and try not to stretch or overstretch too much after exercise. Week 3 and 4 of your menstrual cycle are known as the luteal phase. This is just after ovulation. If your body doesn't become pregnant at this time, then there's a surge in progesterone and cortisol. Cortisol, being the stress hormone, increases your irritability and your mood swings, and also your bloating and the amount that you want to eat. So be mindful of this and maybe try to get out that stress by doing exercise, which is quite a high energy. Also, with that extra bloating and wanting to eat foods, make sure if you're looking at comparing body mass at the end of the month to the beginning of the month, say if you're weighing yourself to see how your progress is going fitness-wise, and you want to check how your progress is going on week 4, that you don't get down, that your body mass might actually be a little bit higher. This is just normal at this time in the month. So if you are going to measure weight as your fitness progression tool, think about weighing yourself on each week of your cycle and then comparing it to your weight on the next week of the next cycle. So once every month, and you're comparing it between the two. It's really important to eat a really healthy, balanced diet to keep your menstrual cycle regular, especially if one of your goals is getting pregnant. But periods are also a really, really good indication of health, because they're normally one of the first things to go if your body is struggling in some way. So if you have lost your period, it's important to seek medical advice. We often think of a really healthy, fit body image as being quite lean for a lady, but actually this might not be the best peak physical health that that woman could actually be in. So think about whether you want a six-pack over whether you want to have regular periods. It's really important to decide whether you're looking for an aesthetic goal or whether you're looking for a health goal. So you might have to sacrifice a little bit of six-pack and muscle and leanness to then have a healthy body, feel womanly, look womanly, and have your period cycle being regular. When you reach the menopause, the hormones actually decrease in the body, so estrogen goes down. With the decrease of estrogen, you could suffer from osteoporosis, which is a loss of bone density. So think about your training styles at this point. It's important to do more strength training as this increases your bone density. Also, it's important to think about what you're eating because you really want to make sure those bones are nice and strong to see you through the menopause. As a woman, we all feel like we want to be a certain way all the time. But if you think about what's actually going on in your body, hormone-wise, they're going up and down all the time and they're causing a lot of different things and processes to happen in your body. So be a bit more mindful about what's going on each month and realise what's actually happening and why you're feeling a certain way. You might want to track your periods on a period tracking app or something so that you are more aware of what's going on in your body and why you're feeling a certain way. Overall, it's really important to just cut yourself a bit of slack and just literally go with the flow.